Welcome back, and thank you for joining us for part 3 of our essential series on routes of drug administration. In part 2, we wrapped up our discussion on the oral and parenteral routes. Today, in part 3, we're diving into 5 more specialized routes, such as inhalation, nasal, sublingual, buccal, rectal, topical, systemic administration. Understanding the oral and parenteral routes is essential for grasping why the specialized routes we're covering today are needed. If you haven't watched parts 1 and 2, links are down in the description. Go back, watch those videos, and then rejoin us here for part 3. Okay, friends, let's start with inhalation route of drug administration, a method of drug administration that's far more clever than just local lung treatment. When most people think of inhalation, they picture asthma inhalers, where the medication works right there in the respiratory passages. That's true for local action. But did you know the lungs also act as a phenomenal systemic highway for drugs? When a drug is inhaled deeply, it reaches the alveoli, those tiny, balloon-like air sacs in your lungs. What makes them special? They are absolutely wrapped in a dense network of capillaries. This massive surface area and direct blood supply allow drugs to quickly diffuse into the pulmonary circulation, completely bypassing the liver and entering the systemic bloodstream within seconds. This results in an incredibly rapid onset of action. This is why the inhalation route is perfect for volatile liquids and gases that need to act systemically. The most classic example is inhaled general anesthetics, like isoflurane. And here's the amazing part. The lungs don't just absorb the drug, they also serve as the primary route of elimination. The drug's effects can be adjusted moment to moment just by increasing or decreasing the inhaled concentration. Once administration stops, the drug simply diffuses back out of the blood into the alveoli and is exhaled out. Let's look at the advantages and disadvantages of the inhalation route of drug administration. One major advantage is its rapid onset of action, as drugs delivered directly to the lungs are absorbed very quickly. Inhalation also allows moment-to-moment control. By adjusting the inhaled concentration, the drug's effect can be precisely controlled, which is especially useful in anesthesia. This route bypasses first-pass metabolism, so more active drug reaches the bloodstream, and once administration stops, the drug is eliminated quickly through exhalation. Another benefit is that inhalation is non-invasive and does not require needles. However, the inhalation route also has several disadvantages. First, it requires specialized equipment, such as inhalers or nebulizers, which may not always be readily available. The effectiveness of inhalation is technique-dependent. Proper patient cooperation and correct usage are essential for the drug to work effectively. Some drugs may cause respiratory irritation, and inhalation is not suitable for all drugs, as only volatile or aerosolized medications can be used. Finally, there is a risk of environmental exposure from exhaled gases or aerosols, especially in healthcare settings. Next is nasal route. When you think of nasal sprays, you probably think of quick relief from a stuffy nose, right? But here's the twist. Some nasal drugs don't just clear sinuses, they enter the bloodstream and act systemically. This route involves simply spraying or instilling a drug into the nasal cavity, where it crosses the thin nasal mucosa and is quickly absorbed into the bloodstream. Why is it so fast? Because the nasal lining is truly exceptional. It's highly vascularized, meaning tons of tiny blood vessels are right at the surface. It's thin, providing almost no barrier to drug diffusion. It offers a direct path to systemic circulation, completely skipping the gut and the liver's first-pass metabolism, for example, midazolam nasal spray. And here's the most fascinating part. Some drugs can even bypass the blood-brain barrier via the olfactory or trigeminal nerve pathways, giving them a potential direct access to the brain. Think of it as a secret shortcut to the central nervous system. So, how does this work? It's a simple 4-step process. The drug is sprayed or dropped into the nostrils using a simple device. It then diffuses across the nasal epithelium, that thin, permeable membrane, Next, it's absorbed into the rich capillary networks right in the mucosa. And finally, it swiftly enters the systemic circulation, or, as we mentioned, takes that direct detour into the central nervous system. This rapid absorption makes nasal delivery an outstanding option for treatments needing rapid onset or those specifically targeting the brain. Now let's look at the advantages and disadvantages of the nasal route of drug administration. One major advantage is its rapid onset of action, making it especially useful in emergencies, such as delivering anti-seizure medications. The nasal route also bypasses the liver, avoiding first-pass metabolism and increasing drug availability. It is non-invasive and needle-free, which improves patient compliance and allows easy self-administration at home. Another important benefit is its direct-to-brain potential, as some drugs can reach the central nervous system quickly through neural pathways. However, this route has limitations. Only small, potent, and lipid-soluble drugs are suitable for nasal absorption. Frequent use may cause nasal irritation or dryness, and absorption can be variable, especially during nasal congestion or a common cold. Additionally, the drug may have a short residence time, as mucociliary clearance can rapidly remove it before full absorption occurs. So, while it's not suitable for every medication, the nasal route is an invaluable tool for rapid, non-invasive systemic delivery and for advanced neurotargeting. Also, it's not ideal for high doses or long-term therapies. Next route is sublingual route of drug administration. Sublingual literally means under the tongue. In this route, a drug is placed beneath the tongue, where it dissolves quickly and is absorbed directly through the rich vascular supply of the sublingual mucosa. From here, the drug travels through the lingual vein, then into the jugular vein, and quickly enters the systemic circulation. Since it's absorbed directly into the bloodstream, the drug bypasses the gastrointestinal tract and avoids first-pass metabolism in the liver, meaning it acts faster and more effectively. A common example is nitroglycerin, used to relieve angina or chest pain. Let's talk about the advantages of the sublingual route of drug administration. Sublingual drugs act faster than oral medications because they are absorbed directly into the bloodstream without going through digestion. This route provides rapid onset of action, often within minutes, making it ideal for emergencies such as an angina attack. It avoids first-pass metabolism, so the drug retains its full potency and achieves higher bioavailability. Almost the entire dose reaches systemic circulation, making it extremely effective. It is also convenient and painless, requires no needles, and does not require swallowing, which is helpful for patients with nausea or difficulty swallowing. However, sublingual administration isn't perfect. Only small doses can be absorbed this way, so it's not suitable for medications that require large quantities. Some drugs have an unpleasant taste, which can affect patient compliance. Not all drugs qualify. Only those that are lipid-soluble, non-irritating, and quickly dissolving are effective via the sublingual route. Conditions like dry mouth or excessive saliva can interfere with how the drug dissolves and absorbs. Lastly, most sublingual drugs have a short duration of action, making them less ideal for sustained release. Let's shift from under the tongue to the cheek. Let's look at how the buccal route of drug administration works. In this method, the medication is placed between the gum and the inner cheek, an area called the buccal mucosa. Once placed there, the tablet dissolves in saliva, and the drug is absorbed directly into the bloodstream through the rich capillary network in the cheek lining. From here, it travels through the facial vein, then the jugular vein, and finally enters the systemic circulation, allowing it to act quickly. Just like the sublingual route, the buccal route bypasses the gastrointestinal tract and avoids first-pass metabolism, giving faster and more effective results. This route is especially useful for conditions that require rapid action, such as migraine or schizophrenia. Common examples include prochlorperazine, maleate, and midazolam. Let's see the advantages of buccal administration. Just like sublingual delivery, Buccal administration bypasses first-pass metabolism, helping drugs retain more of their effectiveness. It allows for sustained release. The drug remains in contact with the mucosa longer, enabling controlled absorption. It's painless, non-invasive, and great for patients with swallowing difficulties. Another bonus? The drug can be removed at any time, giving healthcare providers more control over dosing, moving to the disadvantages and limitations. However, buccal delivery isn't right for every medication or every patient. Only lipophilic drugs in small, potent doses can be absorbed this way. And the onset is slower than sublingual administration, which isn't ideal in emergencies. Some drugs may cause unpleasant taste or irritation, lowering patient compliance. Chewing, swallowing, or even dry mouth can disrupt how well the drug is absorbed. And finally, the buccal mucosa has limited surface area, which restricts how much drug can be absorbed at once. Okay, let's talk about a route that's often overlooked, but incredibly useful in the right situations: the rectal route of drug administration. Let's see how it works. First, the drug is inserted into the rectum, usually in the form of a suppository. Once inside, it melts or dissolves in the rectal fluids, releasing the active drug. The drug is then absorbed through the rectal mucosa, which has a rich blood supply. From there, it enters the inferior and middle rectal veins, allowing the drug to partially bypass the liver's first-pass metabolism and reach systemic circulation. This route is especially useful when patients cannot take oral medications due to vomiting, unconsciousness, or difficulty swallowing. Common examples include paracetamol for fever and bisacodyl as a laxative. Here's the advantages of the rectal route. First, it's ideal for patients who are unconscious, vomiting, or unable to swallow, such as in emergencies or palliative care. It's also helpful in children or patients who are uncooperative or unable to swallow medication. The rectal route partially avoids first-pass metabolism, which can increase the bioavailability of some drugs. It's effective for both local effects, like in hemorrhoids or proctitis, and systemic delivery. In emergencies, such as seizure control, rectal administration can be life-saving. Let's see the disadvantages of rectal route. Despite its benefits, the rectal route does come with challenges. There's often discomfort, social stigma, or cultural hesitation, making this route less acceptable to some. Absorption can be erratic and unpredictable, depending on rectal contents, circulation, and body position. The limited surface area of the rectal mucosa also restricts how much can be absorbed. It's not suitable for large volumes of medication. Some drugs may irritate the rectal lining, causing local discomfort or inflammation. And for long-term therapy, it can be inconvenient and less acceptable. Welcome to the topical route with systemic absorption, a unique way to deliver drugs across the skin or mucous membranes directly into the bloodstream. What is the topical systemic route? Let's take a look at how topical systemic drug delivery works. Step 1. The drug is applied to the skin or mucosal surface, often as a cream, gel, or transdermal patch. Step 2. The drug begins to penetrate the stratum corneum, which is the tough outermost layer of the skin. Step 3. It then diffuses deeper into the dermis, where blood vessels are located. Step 4. From there, the drug enters the systemic circulation, traveling through the bloodstream to reach its target site in the body. This process is typically slow and controlled, making it ideal for sustained-release medications, like hormone patches, pain relievers, or nicotine replacements. Examples include the nicotine patch for smoking cessation and testosterone patches or gels for hormone therapy. Let's look into the advantages of systemic topical route. First, it bypasses the liver, avoiding first-pass metabolism and keeping more of the drug active in the body. It offers sustained and controlled drug release, helping maintain stable blood levels over time. It's non-invasive, painless, and easy to use. No pills or injections required. That convenience leads to better patient compliance, especially in chronic conditions that need continuous therapy. Moving to the disadvantages of this route. But despite the convenience, there are important limitations to consider. Only potent lipid-soluble drugs can effectively cross the skin barrier. Some people may experience skin irritation or allergic reactions at the application site. The onset is slow, so it's not suitable for emergencies. Absorption can vary depending on skin thickness, hydration, temperature, and application site, and it's limited to small doses. The skin can only absorb so much at a time. That was a quick tour of some really interesting drug routes, from the fast action of inhalation to nasal shortcuts, under the tongue speed, cheek absorption, the practical rectal route, and the slow, steady effects of topical drugs. Each route has its own role, strengths, and limits. Knowing when to use which route helps make sure the right drug reaches the right place at the right time, safely and effectively. Thank you so much for joining us in part 3 of this series. If you found this video helpful, make sure to like, share, and subscribe so you don't miss the next part. Stay curious, stay informed, and I'll see you in the next video.